All right, so we're removing this nail because of the chronic fungal infection. Because there's only one nail involved, you know, we're doing this instead of taking the medication for 3 months, right? Okay. All right. So here we go. Just relax here. There you go. You're doing great. There you go. Excellent. So you're doing better than you thought you would. You're doing fine. Okay. Very good. Now we do the other side of the toe. You're doing fine. Excellent, excellent. There we go. That's it. Very good. You did very well. It wasn't so bad.
You just telling me.
No, I'm telling you. He said you were going to cry and scream and all of this stuff, and you didn't do any of that.
I didn't?
Nope.
It's like, it's fine, it's fine, it's fine.
Now you start feeling the toe go one more numb over the next few minutes.
Thank you, sir.
All right.
Okay, thank you.
Now through the procedure, you'll feel touch and pressure, but you shouldn't feel any pain. But if you do, let me know. We can give you some more medication, okay?
What other thing you could use?
You can use alcohol, you can use chlorhexidine. So while we start, when you're giving a prep, where you're doing the surgery. So you go in and out. So we're doing the surgery on the nail, right? Excuse me. And so we start at the nail, and then we go out. Okay, not going back in. Because you don't want to bring germs back to your surgical area, right? So this is not a procedure to prevent the nail from growing back. This is to get rid of the fungal infection. So we're not going to be using the phenol or anything like that. So again, start from the surgical site and you move out. You never go out back to toward the surgical site. What we have to do is loosen the nail from all its attachments. From this nail fold here, we call the proximal nail fold. From this side, we call the medial nail fold. From this side, we call the lateral nail fold. And then we have to get underneath the end and loosen it from its attachment to the nail bed itself. Okay, so we'll start here first. All I'm doing is just pushing back the cuticle until I feel a pop. And so when I feel that pop, I know that I've released the nail plate from its attachment underneath the nail fold here. All this fluid you see here is the anesthesia that I gave. Shooting through. Okay, so the proximal nail fold is released. I'm all the way in it. All right. Now I'm going to do the lateral nail fold, just here on the side. Okay. Close the door for me. Thank you. Loosen it over here. Same thing over here. on the medial side. How you doing up there? Still got your headphones on?
Huh?
You good?
I'm good. I'm fine.
All right. All right, so now we have to get underneath the nail. So I just a little bit at a time. Come under the nail. There, see that?
Mm-hmm.
See how the nail plate comes up? I did it here. I'll do it again over here. Loosen it up. Here. Once you start a path, it's pretty easy. You don't have to really use a lot of force. Here. Now what's real difficult is when the nails are very thick. You know, and a lot of fungal debris underneath. Like over on this side, where most of the infection is. See how it's harder to get the instrument underneath here?
Yeah.
Because of all that debris under there. But you want to be sure you get it all clear because it'll be easier to remove the nail at the end. There we go. Now we see where we are. It's a pretty loose nail now. See that?
How?
Did that hurt?
Yeah.
Or you felt pressure?
Huh?
Is that pressure or pain?
Pain. Just a little bit.
So now I can come under here, the nail fold. Come back the other way. See that? See that?
Yeah.
Now I'm all the way through. I can just lift out. So there's still some skin attachment there. So I'll take my scissor. And release that. There it goes. And I can take my hemostat and get this other side. And just roll it out. There it goes. Now I want to, if there's any skin attachment, I want to cut it off, not tear it off. I don't want to just pull. Okay? There that goes. And there it goes. And underneath, you can see all the buildup here. See that there? All this fungal, dead skin and stuff under here. Got it? Now, when we look at the nail bed itself, you can see all this buildup here. See all that?
Yeah.
That's where the majority of infection is. Okay. So we got this piece of loose skin that we have to remove here. Again, we trim it off. We don't just pull it. And that's it.
Is it?
Yeah, we're done. As far as the nail's concerned, now we just got to clean you up. This spray.
Good job, Dr. Jefferson.
I appreciate that. Go ahead. Thank you.
It hurt from there, but
There we go.
And this will make the nail grow back.
Yeah, the nail's going to grow back on its own. And in about a week or so, once
you got a
this
lot
is
of stuff in it, Dr. Jefferson.
a little bit.
Huh?
Not that much now. I'm cleaning it out.
Okay. So did that nail polish help?
The nail polish
You
actually.
know the medicine.
Oh yeah, it helped a bit.
Okay.
Did you see the difference between the nail bed here? See how it's kind of bumpy and not smooth versus here in the middle?
Yeah.
Yeah, so that's where the majority of the fungal infection is, over in here. So when she comes back next week, when we look at it, make sure everything is okay, then we'll start on the fungal cream here on the nail bed. You get one more spray. Thank you. So she'll soak it starting tomorrow, once a day for about 30 minutes in warm water, Epsom salt to help dry all this out. And she'll put antibiotic ointment and a Band-Aid on it every day to keep it clean and protected. So this is our antibiotic ointment. Put it all on here. Now, because there's no real cutting of skin like when we use a scalpel, most folks don't have much pain afterward. Because if the most painful part of removing a nail is actually loosening the nail up. But because they're numb during that time period, they don't experience that. So once the anesthetic wears off in a few hours, that painful process is over. So most folks don't have to use any pain medication after the procedure. Look at that clean she has right there. Off comes our tourniquet. And we wrap her up. And send her home with the written instructions about everything we just discussed. And tomorrow she'll start the treatment at home. And the reason why I put this big bandage on it today, because there is some bleeding that can be expected.
Yeah.
And just a regular Band-Aid won't handle all that. So I'll make this entire thing.